Okay, great. Well, thank you all so much for coming to our bi-weekly COVID meetup and check-in. My name is Amelia. I am facilitating the check-in for today. And ooh, there's a fun fact from Laura in the chat that says, on December 21st, the winter solstice, Jupiter and Saturn will be so closely in alignment that we will see the brightest star in 800 years. That's really cool. Thanks for that little tidbit, Laura. um, so for today's agenda, we are going to be going through our 3 deep breaths. We'll talk through some vaccine news updates. I did a quick search and looked at some things today to share. I have the Montana COVID-19 vaccine plan update. DPHHS just released a press release yesterday, so I'll go over the details on that. Then we'll talk about COVID and the workplace and mandating vaccines. This is more just to open a discussion about this topic. This is something that's starting to be talked about and thought about, so something for all of us to consider. And then we'll talk about self-care and mental health resources, and then some resources and reminders for all of us to share with you. At any point in time, if you have any other topics that you'd like to bring up, please do let us know. Either put it in the chat box or you can unmute yourself. We're a pretty small group, so you're more than welcome to do that. So we'll go ahead and start with our 3 deep breaths. I have a picture of hot chocolate here because 'tis the season, and I hope that you all are indulging in your hot chocolate cravings whenever they might come. But go ahead and sit up straight in your chair, put your feet down flat on the ground, kind of bring your shoulders down and lift up your chest, and really try to open up your lower belly. Try and send your breath down there, as opposed to just keeping it in your upper chest. So let's go ahead and breathe in and out. In and out. In and out. Okay. So the first thing that I wanted to mention were some vaccine news updates. I have some articles here which I will put into the chat box after I talk about them. There's a lot of stuff that's being written right now about the vaccines, I'm sure you guys are all aware of. But these were sort of the things that kind of I thought were important developments that would be good to be aware of and things that I wanted to summarize for you. So in case you guys haven't seen, the UK has actually started giving the first COVID-19 vaccine doses. I believe they started sometime earlier this morning, our time. So British regulators approved the use of the Pfizer vaccine last week, and they have started to vaccinate people. And so people are watching the UK. I think since they're the first people who are doing this, we're all kind of watching to see how they administer and implement their vaccination plans, and we'll probably all learn a lot from the UK doing this. Their vaccination campaign is going to take many, many months. So something that actually has been mentioned in all of these articles and a lot of the articles out there is that you can't just like not wear a mask anymore after you receive your vaccination. People still will need to be mindful and careful, and restrictions will probably still be in place until the spring, until a large enough section of the population has been vaccinated. So just keep that in mind. A vaccination is not like a boop, you're done and now we can go back to everything as normal. We will still have to do a combination of social distancing and being careful and limiting interactions until the effects take hold. So Britain received 800,000 doses of the Pfizer vaccine, which is enough for 400,000 people. Just remember that a complete vaccination is 2 doses. So you get 1 dose and then you wait depending on the vaccine, you wait like 21 days or 28 days, and then you get the second shot. Um, so the first shots in the UK are going to people who are older than 80, who have been hospitalized or are scheduled for outpatient treatment, nursing home workers, and then vaccination staff. So the most vulnerable will be vaccinated in the early stages, but most people will probably need to wait until 2021 for more vaccines, depending on the rollout and the tiers. For the first phase of the UK vaccination plan, that first phase is targeting, I believe, 25 million people, so 40% of the population, which includes the most vulnerable and essential workers and people that they listed according to their prioritization plan. So they're going to need eventually 50 million doses. So this is just the first foray into this. We're all watching to see how it goes, but yes, very exciting that this has started. Vaccination plans have started in the world. I also wanted to cover a little bit about vaccine development, and we've talked a little bit about the mRNA technology that's used in the Pfizer, Moderna, and AstraZeneca vaccines. But how is it such that we were able to create a vaccine in, I don't know, like 10 months, 11 months, a year, when typically vaccines take like a decade to go through the entire research process, clinical trials, all of that safety testing and FDA regulations and all of that stuff. So there's a lot of things that happened. It wasn't just like COVID happened and then we're like, oh, now we need to start researching things. So COVID belongs to the group of coronaviruses. There's not just one, there's many. And there have been previous outbreaks that have kind of allowed us to gain insight into coronaviruses in general. So if you guys remember SARS and MERS and other respiratory outbreaks, a lot of those were different types of coronaviruses. So from those outbreaks, we had already done, kind of the global health community had done a lot of research on this topic and how they work and how they operate. And so there's a lot of similarities and carryovers from that research that helped with COVID research specifically. So a lot of stuff had been happening in that area beforehand. And then mRNA technology, which is being used in these vaccines. So typically, I think with like flu shots and with other vaccines, sometimes you have to like breed the vaccine, brew it in a vat or something, or sometimes you brew it in like chicken eggs or in some sort of like animal environment, and then you extract that and purify that and use that to make the vaccine. But with these vaccines for COVID, this uses mRNA technology. So that's messenger RNA technology. So that just uses pieces of genetic code that instructs the body on how to make certain kinds of proteins. So you choose the right protein, virus protein to target, and then it's the right spark that turns your body into a little mini antibody factory. And so it jumpstarts the immune system to create those antibodies and react to, in this case, the COVID virus. So mRNA technology itself had been used and had been started to be researched many years before this, and it was just a matter of taking that and applying it to COVID. Also, there were like billions and billions of dollars that were thrown at this research, which never hurts. So that's how all of this kind of came together and sort of fast-tracked these vaccines, and all these pieces kind of fell into place and allowed these companies to create something so quickly. So this is more just to give kind of context and background to the vaccine so that especially if people are like, well, why should I trust this? Where is this coming from? It just seemed to come out of thin air. A lot of the research that this is based on has actually been ongoing for many, many years. The coronavirus itself is similar to previous diseases that have been studied. And so a lot of that was just kind of built upon and leveraged to create these vaccines. Oops, sorry. And I included this article from the New York Times, which kind of goes more in depth about why people who've been vaccinated will probably still need to wear a mask. And so this is because, so the Pfizer and Moderna data shows that the vaccines are good at preventing serious illness, but it's unclear how well they curb the spread of the virus. So that's two different things. So that's, protecting you from getting super sick, needing hospitalization. It's very good at that, but it's not, they didn't really test the spread of the vaccine, of the spread of the virus within vaccinated people. So in the clinical trials that they did, they tracked how many vaccinated people became sick with obvious symptoms. And they kind of classified those into people who got sick with severe symptoms and then people who got sick with mild symptoms. However, they did not track the vaccinated people who were quote unquote sick, but they didn't have any symptoms, so asymptomatic, and they could still potentially be transmitting the virus. Um, so, if people are getting vaccinated and there's this sort of like sense of relief, like, ooh, yes, finally we can start relaxing these social distancing restrictions. We don't have to wear masks. It could potentially make it easier for asymptomatic vaccinated folks to spread COVID. Um, so this might put unvaccinated people at risk. Even if you get the vaccine, while you might not be sick, you could still be spreading the virus. So it's just, they're saying that it's just still really important that you still wear a mask because they just don't know. This part hasn't really been researched very much, and they're just not really sure. So it's better to be safe than sorry. And so a combination of both the vaccinations and still being careful and vigilant will kind of help to prevent any unnecessary spread. Um, I was also reading a little bit more, and it goes more into this in this article. But with respiratory infections, the nose is the like grand central station of virus entry and exit. So the virus lives there. It often enters first through there, and it multiplies there. And so the current vaccines are shots, so they're injected into muscle, not into your nose. So it dissolves in your bloodstream, and it does jumpstart your immune system and produces antibodies. But it's unclear how many of those antibodies like pool in your nose and how much they prevent the virus from multiplying there. So actually, typically with a lot of respiratory infections, they often say that mucosal vaccines, so nasal sprays and things that target the nose specifically, are a little bit more effective. So they're looking into that option for COVID vaccines in the future, but right now the shot's the only thing that's available. So they're just saying that the nose slash asymptomatic spread is just an unknown factor, and it's better to be safe rather than sorry. And in overall, just talking about vaccines, they say that preventing severe disease is the easiest. That's like the low hanging fruit when you're creating a vaccine. Preventing mild disease is harder, and then preventing all infections is the hardest. So to reach that final tier, it's going to need to be a combination of both the vaccinations and still sort of social distancing and being careful with each other. Um, so those were the main things that I sort of was looking at today. If you guys have any questions, or if you guys have read anything else, feel free to let me know. And I'm going to go ahead, while we pause, I'm going to go ahead and put some of these links into the chat box.
So we're in a meeting.
And I do encourage you to just kind of do a quick Google and take a look at what's out there. There is a lot being written on this right now. But yeah. Any questions or anything? Also, one quick thing before I forget, I forgot to mention that I'm trying to keep better track of attendance in Aspen. So if people could just, if you want Aspen credit, if you could just put your name, your full name, first name, last name, and library into the chat box. That way I'll have a record of who was here in this webinar and can put that into Aspen later on. So if you don't mind just typing that in, I can go in and confirm people's credits. Let's see, there's a question from Kathleen. I'm curious if the vaccine trials have not really focused on whether someone can still spread the virus after being vaccinated, why the big push for everyone to be vaccinated instead of leaving it to individual choice? Oh, oops, there's other, oh, those are just, okay. So I don't think that there's like a huge, well, I don't want to say because I don't know. Um, I think the whole like asymptomatic spread of the virus in vaccinated people, it's just an unknown factor. And I think people would rather, especially with the vaccines going out and people getting protection and people feeling like it's more safe, I think people are afraid that with the loosening of restrictions, they're going to be infections that could be easily avoided. I think it's just an unknown factor, and so they don't want people to fall into that trap. So the vaccines are like a level of protection, of course, but I think they want people to be as safe as possible. So they're just saying that's a factor that can't be eliminated. And I guess it's still kind of with, you know, like with the vaccines, sometimes people still do get sick after they get the vaccine, but you're not getting as sick. It's not 100% protection. Unfortunately, nothing is 100% protection. Um, Also, thank you people for putting in your names. Any other questions about vaccines? And also, I think Kathleen, I mean, obviously, clinical trial data is still kind of incomplete with the vaccines because of some of the timeline. But with 95% effectiveness of people not getting infected, since they have those antibodies already in their bloodstream, um, it will prevent, hopefully, people from getting sick. So the data has been very promising. All right, I'm going to go ahead and go on, but feel free to bring up any other questions that you might have. So the next thing that I wanted to mention was the Montana COVID vaccination plan. So DPHHS had a press release yesterday that talks a little bit about kind of the first stage of Montana's vaccination plan. So Montana is scheduled to receive the first vaccine allotment in mid-December. It's important to note that I don't think the FDA has yet approved emergency use authorization in the states, but I think that meeting is happening on December 10th, and I would be very surprised if they do not approve it. So I think a lot of people are announcing things and banking on the FDA approving it. So our first allotment in Montana is supposed to be delivered sometime in mid-December, and it's 9,750 first round doses, and this is the Pfizer vaccine. So that's going to be mostly to healthcare workers. In the press release, they have a list of hospitals and distribution, like places that they're going to be administering the vaccine. So you can take a look at that. And then that's the first dose that will be coming in mid-December. And then the second dose of the Pfizer vaccine will be delivered within 21 days of that first dose being administered. So it's unclear when exactly that is, but they're planning on it coming within that time period. So this first allotment is all going to be Pfizer vaccine stuff. So if you remember in our last COVID meetup, it's the super ultra cold one. So you need like special refrigerator boxes or whatever. But the second allotment, which it was unclear when exactly that was coming. The second allotment, though, will be a mixture of Pfizer and Moderna. Um, so obviously the Pfizer vaccines will need the cold temperatures, but the Moderna ones don't. I think they just need normal refrigeration. So those vaccines, I think, are going to be allocated towards rural locations because it'll be easier to transport and store them in those areas. So I'm going to go ahead and put that link into the chat box so you can, excuse me, take a look at that and read that if you would like. And we'll keep you updated on any other updates with the vaccination plan as they come forth. Laura asks, any word on what the vaccinations will cost? I think they're probably making it free. I have not heard any mention of cost. I think they're trying to get as many people to get the vaccine as possible. So I think in Montana they've been talking about having them be free. I think in other places they're actually, well, actually I don't know, maybe not. I thought I remember reading something about people paying people to get the vaccine to further incentivize, but I think it's going to be free. I have not read anything about cost so far.
I I did see something about cost. It was going to be something about maybe the people administering the shot, like $10 fee for giving you this shot type of thing.
Mm-hmm. Okay, thanks, Jennifer.
Yep.
Yeah, if I see anything, I'll be sure to mention that in our next COVID meetup too. But any questions about that? Sarah says, by the time I get one, there should be lots of new data. And Janine says you might have to pay for an office visit. So, okay. All right, moving on. So this is an article that I wanted to share, and let me actually go ahead and put this in the chat box before I forget. And this was, oops, this is an article that was, it's from the Washington Post. And I think this is going to be a topic that will be coming up more in the future. But as you can see from the title, the employers have a question of, can we require people to get the vaccine? So this is a very, the gist of the article is that there's not an answer right now. There's no yes or no answer. This is just a topic of discussion that's been opened up. And so a lot of employment, labor, and like those kinds of folks are talking about this. And it's sort of an unprecedented situation because there are cases in which vaccines are mandated in workplaces, such as flu vaccines and flu shots for people in healthcare related fields. But it's pretty rare for vaccines to be mandated outside of healthcare fields. And especially with the COVID vaccine, I don't think it's been done where people have required a vaccine that's only under emergency use approval. Like flu shots are, you know, those have a lot of data behind them. They've been very established, but with the COVID vaccine and with the status as emergency use approval, still pending in the States, that's also a new kind of situation. So this article just brings up a lot of really good points to kind of think about. So we wanted to just share that with you and see if you had any questions or thoughts about that. And I think it's something that will be discussed more in the coming months. And there's a comment from Kara saying that public school students are required to be immunized. Yes. And let's see, some other notes that I had taken from the article. Another thing to consider is that it will probably be months before like non-healthcare slash essential workers slash vulnerable people will have access to the vaccines, because there's a priority list. So it probably won't be until spring 2021 that we're really going to have to think about this. A lot of people are still waiting for guidance from federal agencies before setting policies. Oh, I forget the exact federal agencies that they were mentioned in the article. But those people are actively talking about it and consulting with lawyers and consulting with unions, et cetera, et cetera. Once the vaccine receives formal government approval, employment lawyers were saying then it can be treated like a flu shot, which can be mandated. Some companies are planning on acquiring the vaccine themselves to make it available on site to employees who want to take it voluntarily. And then they said they just, other things to keep in mind are federal and state law, unions, labor organizations, that sort of thing. So there's a lot of people at the table. There's a lot of conversation happening. But, we figured we'd bring it up to you all and something for you guys to consider. Question from Jennifer, is there going to be an app on phone saying I have been immunized? I don't think so. I have not read anything about an app. Joe said in the UK they are issuing cards with immunizations as proof. Yeah, it might just be like a paper thing. Who knows? And then Laura asked, have you read anything about potential side effects of the vaccine? I think I would actually, Laura, I would recommend looking at the press release from Pfizer. They had a nice kind of summary of all their clinical trial data, and they did have a section on side effects from the vaccine. I don't remember what was in there. I remember skimming it, and I don't think there was anything super scary. Uh, but it is listed in Pfizer in their press release. So I recommend looking there to see. It was under the percentage threshold, though, that's acceptable for most vaccines. I think it's like 1% or something like that. Any questions about that? Okay, we shall move onwards then. Another thing that we wanted to mention was mental health and self-care. So, these are very, very unusual circumstances that we are all finding ourselves in, and we've all had to pivot and adjust in unforeseen ways. And it's also just been a long grind. And so, I think we all have sort of, or you all as public librarians have probably had a pulse on like the community's vibe, and how people are feeling, but it's also important to have a pulse on your own vibe and how you're feeling. So we just wanted to put forth a few resources for mental health and self-care, and see if you all had things that you'd like to share that have been helpful for you. WebJunction does have some materials on preventing and treating compassion fatigue with self-care. For those of you who attended the fall workshop session on, I think there was a fall workshop session on self-care. Joe, you feel free to correct me if I'm wrong about that. But there's also a couple other things that we've listed here: disaster response stress management from SAMHSA. There's a little compassion fatigue wallet reminder. You can print this out and carry it with you. The Idaho Commission for Libraries has a webinar series, or a two-part webinar, titled Self-Care During a Pandemic. So I encourage you to check that out. And, if this is a topic that people are interested in seeing more of, please let us know, because, especially if this is something that people are struggling with, we're more than happy to try and find a trainer or a workshop to help address this.
We did do, this is Joe, we did do a session at virtual fall workshops with Corinne Peabody, and she conducted a 3-hour self-care and collaboration session that got pretty good reviews. And in fact, Tracy's in the process of hiring her back to come and work with the state library staff specifically. So she's available if your library is looking for a presenter. She's already worked with libraries in Montana, and just contact me and I'll be happy to put you in touch with Corinne, and hopefully we'll get her back to Montana sometime soon. I can share what we paid her and what the outcomes were from her session.
Awesome, Joe. Thank you.
Some people are commenting in the chat about that session.
Mm-hmm. And the last document on here, the critical incident stress debriefing, this isn't pandemic specific, but this is just for I think it was originally designed for first responders and EMTs, who, as you can imagine, might encounter some very distressing, traumatic situations. And so that's the critical incident. And this is a way for people to kind of process through that and kind of understand what happened, and really kind of come to terms with that, or at least try to start doing that. So this wasn't really a link. This was actually a file that Joe put together. So I'm going to put that into the chat box. I'm going to share a file, and hopefully this works. Yeah, so now in the chat box, you should see a file called Staff Safety. And so it goes through how you can kind of do this with your own staff if you're interested in doing this, if you feel like this might be helpful for people. There were a couple, oh, sorry, Joe, were you going to say something?
No, I was just to point out that it's a 7-step process. It's very widely vetted. You need to do every step. You can't skip them. And I think if you're not comfortable doing this, you could probably find a firefighter in your community who's, had experience being in these. Are really commonly done after incidents, especially incidents that involve fatality. So if you have something that happens to someone in your community related to this event, a trauma event, then it's, and I did actually kind of create this for COVID. So it's very kind of COVID, the language is all kind of surrounding, the questions are surrounding COVID in libraries, but you wouldn't have to do this yourself. You could find first responders in your community who are already familiar with the process.
Great. Thanks, Joe. And Joe, I'm just going to say, if people have questions about it, they can reach out to you. I hope that's
that would be fine. I've participated in them before, and they're quite helpful.
Great. There were a couple other comments in the chat. Janine had said, I don't think they know enough about the long-term side effects of could this potentially mess with the person's DNA. Jennifer had said, I saw something that says it doesn't affect DNA because the body gets rid of mRNA when it's done doing its job. And then Kathleen said, in response to Janine, I have concerns about requiring a vaccine that is so new rather than making making it available so that those who want it can receive it, and those who want to wait for more research can make their own personal medical decisions. So I think for Janine's comment, I have not read anything about affecting DNA. I I think the only things that I've really read about affecting DNA are like not necessarily vaccine related. It's more been like radiation stuff. I don't know enough about that to say definitively yes or no. But I do think that this technology has been used in other instances and has not been um, has not resulted in fundamental changes in people's DNA thus far. I can do a little bit more research into that and take a look. But I think from what I've read of the mRNA technology, it is sort of just on the surface edge of cells. And I think similar to how like a virus doesn't necessarily change your body's DNA, I don't think the mRNA can really change your body's DNA. But I'll look a little bit more into that and see. In response to Kathleen's comment, I don't think you're alone in feeling that. I think, I mean, it is really unprecedented to have a vaccine happen in such a short amount of time. And like I said, there is a lot of stuff that happened before this, before COVID even happened, that allowed for the vaccine to be fast tracked. But you know, that is definitely a risk with anything. I mean, you know, with any kind of medical thing, there's no telling what the long-term effects can be with any new medical procedure, with any new medical whatever. You really can't tell until time has passed. So I understand your concerns about that. And I think a lot of other people share those concerns. And I think, you know, even if we are going ahead with doing the vaccines, whether they're required or not, whether people are taking them voluntarily, I think this is something that people are aware of and are trying to monitor. So if something does happen, people will be at the ready to kind of assist with that and sort of troubleshoot that. But I think initial data has been pretty promising. Um, and you know, we'll have to wait and see. Um, Along with the mandating part, I mean, again, that's a very complicated thing. Um, so I don't know. I don't know if the vaccine itself is going to be mandated on statewide or federal levels. I haven't really read as much about that. So if anyone has, feel free to contribute. Um, but um, I think we'll all be looking at Britain to see how things are going there. And then, as you said, we'll also have to wait sort of for the long term to see what the effects are. Any other comments about that? Any other comments about mental health and self-care? Any other resources that you found helpful? Okay, then maybe let's go on. All right, so now we have some resources and reminders. These are just some things that I wanted to remind you all about. So the community events calendar, this is on the Aspen page, and this is for any library that's doing virtual programming that would like to share it across the state. So this is just a calendar page, and it has events that libraries are listing and putting up themselves, and you can add your library's events on here. There's a link on there to submit your event if you would like. And once you've submitted it, I get an email and then I can approve it. And so it'll display on the public calendar. So again, any sort of virtual program that you'd like to share, feel free to. And then there's also the library service survey. So if your library has recently reduced hours or increased hours or maybe closed or whatever, please remember to update the library service survey so that we have an accurate map of it on the state library page. And then I've also included the library Wi-Fi survey because this is an audit of Wi-Fi offerings at libraries across the state. So that's also helpful for people to know. And then the Montana Share Catalog has some information about system support. So I think, Kylie, you're on this call?
Yeah. Hey, Amelia. Thank you.
Yeah.
Just wanted to throw the reminder out there, and you can actually go to the next slide, Amelia, because I did a cool picture. This is not what your MSE system folks actually look like when they're at work, but something similar. We just want to remind you that some things we can do for you in the event that your library has to close unexpectedly or has some other issue due to COVID or what have you. We can adjust closure dates in the system. We can adjust due dates for your items, as well as due dates around holds. We can also adjust or remove overdue fines and help you set up or tweak your patron notifications. And there's other stuff we can do as well. So if you're not sure if there's something we can help you with, it never hurts to open a ticket. And we also have an article on this in our knowledge base system that I'm going to share in chat right now. So don't feel like you have to memorize any of this stuff, but we are here if you need us. So thanks for listening.
Thanks, Kylie.
Well, wait a second. I think Kylie should tell us how many downloads they've had of the new app.
Oh, we have had actually over 600 downloads of the new app for the consortium.
Going viral.
So, Kara, it is fancy. So if folks have questions about the app also, or really anything, you can just ask us any questions. Please open a ticket or give us a shout. We'd also love to hear what your patrons are thinking of the app and how it's going for you. So feedback is also welcome.
Cool.
Thanks Joe.
And just a quick reminder to people that you can download the chat. I know we stuck in a lot of links in here, but if you go to the chat and then you go down to the bottom right, there's file and then a little ... menu. If you click on the ... button, there's a save as, and you can download the transcript. I will also be putting all of these links into the Vimeo description when I upload the recording to Vimeo, so you can always find it there as well. I was also going to say one last thing and I forgot. Oh, I think there were a couple people who came in a little bit later into the webinar. So again, if you do want your MSL credit in Aspen, please put your first name, last name, and library into the chat so that I can approve you and add you in Aspen. So please don't forget to do that before you go today. And that's it. Ta-da! That's the end. I hope that we covered all of the topics that we needed to. If anyone else has any questions, please do put that into the chat box or unmute yourself. I'm going to go ahead and stop the recording now.